Hi guys, and welcome back to another vlog. So this day I had oncology ward or cancer ward, and as I showed you in the previous clip that there are loads and loads of patients in this ward. So it gets really busy, and the problem here is that the patients don't have their own file with them. It is only that when they are visiting the doctor that they have their file. So that's why here we are copying the patient information from the computer itself. So the computer has all the patient information, what time they came, what were their chief complaints, and what are diagnostic procedures they had, diagnostic tests they underwent, what was their drug history, what was their discharge medication, etc., what was their radiation and chemotherapy schedules, everything. So it becomes really busy, and we had to copy it fast because obviously the nurses and the doctors, they wanted the laptop again. So luckily enough, I have found a patient case file of cancer. She is 61-year-old female and she was diagnosed with left breast cancer. Her histogram is normal, serum creatinine is normal. And in cancer there are two types of medication. One is the medication which targets the cancer cells itself, which is the main chemotherapy, and the other medication, they are the adjuvant drugs or support therapy. So why the support therapy is needed? Because the medications for cancer, medications which kill the cancer cells, they are very brutal. They are not able to distinguish between the cancer cells and the normal body cells. So it leads to a number of other problems such as nausea, which is also known as CINV, that is chemotherapy induced nausea and vomiting, alopecia, that is loss of hair, and then the immunity goes down, etc. So for that, support therapy is given. In this case, the main medication were injection of doxorubicin and endoxan. So doxorubicin, it is an anthracycline. It works by slowing or stopping the growth of cancer cells in the body. And endoxan, it is an alkylating agent. It alkylates or it binds to DNA strands. So it is a cytotoxic medication. So these two were the main injections, the main medication that she was given. And upon discharge, she was prescribed the support therapy or adjuvant chemotherapy. So for that, the support therapy, for that she was given famotidine. It is histamine blocker, H2 blocker. It is used to treat heartburn, nausea and chest pain, which is associated with chemotherapy. Then she was given perinorm, which is also CINV medication. It is antiemetic. It is D2 blocker. Ondansetron is a serotonin blocker, which is also CINV. So mainly all the three blockers have been given: histamine, serotonin and dopaminergic. So these three receptors are mainly responsible for nausea and vomiting, and they have been blocked. That is histamine, dopamine and serotonin. Histamine blocker famotidine, D2 or dopamine blocker perinorm, and serotonin blocker ondansetron. Then she has been given dexamethasone, which is a corticosteroid. It is used to reduce the inflammation. Then she is given lorazepam, which is again a benzodiazepine. It is used to treat anxiety and sleeping problem. This is again also for CINV. It is GABAergic receptor blocker, that is GABA receptor blocker. Then she is given Beplex Forte, which is for nutritional deficiencies, and syrup Clemafin. It is used to treat constipation. Injection GCSF, now this you will see very commonly prescribed. So this is filgrastim. It is used to stimulate the production of granulocytes, which are WBC, as the patient undergoing therapy will obviously have low amount of WBC. So this is us returning to our SIR for the discussion of cases. So at the end of every ward round, we discuss our cases with the SIR. We discuss about the kind of patient we had, what he or she was diagnosed with, what were the medications given to him, if at all, then what were the adverse reaction that he or she experienced, what were the drug interactions, what was the class of medication given for that particular kind of disease, etc. So that is it, and after that we went off to college.